So we're going to grab an elastic band, preferably one that doesn't have an end to it, because we're going to use this stretchy elastic band around the base of our neck to protect the first rib from popping up. Yes, the ribs go up that high, so I'm going to get you to grab it, really pull it tight right at the bottom of your neck, because when we're stretching out the scalene muscles, these are the muscles on the side of the neck, and specifically they attach into the first rib. We don't want these muscles pulling up that first rib. So there's actually 3 different types of TOS. So there's one where you feel like a numbness or tingling or burning going down into your arm. There's also one where you're getting lack of blood flow. And there's also one where you're not getting good blood return. Okay, so that's neural, arterial, and venous TOS. The most common is a neural from what I see, but it's also sometimes possible to have a neural plus arterial. So that's exactly what we're going to target today. So throughout this time, I'm going to get you to mirror me as best you can, and whatever side you feel the numbness, tingling, or burning, or the lack of blood flow on, you're going to put the elastic band on that side. So if you're mirroring me, you'll be doing the right side if that's the side that you have an issue on, or you'll be doing the left, which is the same side I'm doing. So there's kind of no right or wrong way when you're stretching out the scalenes in this case, because we have the first rib already being pulled down. But I want you to specifically side bend, and then you can gently kind of play around with looking up towards the ceiling, gently, slowly controlled, and looking down towards your armpit essentially. So now after these couple minutes, we're going to gently release here and move on to the floor. So this is where we're going to release the pectoralis minor muscle, which is another area the nerves and arteries can get pinched. And we're going to place that right underneath, kind of where that pec muscle is. Everybody knows where that pec is. And there's going to be an area that's very tender. And I want you to place it right there between the shoulder and the ribs almost. And as we're lying on the floor, you're just going to gently move your arm up and down. And of course, reposition the ball. If you notice that the tension there under the tennis ball or lacrosse ball or the dog ball that I'm using here is diminishing, then move it around, find a different area where it is giving you a problem. So you see here, I just did that. I'm adjusting, especially if it's starting to fall out of place or it's starting to move and shift to an area that I don't want it to be. Good, and just the last few here. Don't forget to breathe here. I know, especially if it's painful, just keep breathing. And also to note, if you're getting numbness, tingling, burning here, give yourself a break. Don't try to push through it. You don't want this to get worse. Okay, and I'm angling it a little bit different here so you can see where I'm placing the ball. Good. Again, just a few more. Now we're going to lift out to the side. If you can, lift your arm out to the side and kind of pulse it there. Good. Keep going and pulse. Good, and reach down, and then we're going to remove the ball here. So now let's stretch it out. So essentially you're going to get on to an angle where you're pushing yourself into the arm on the side that you're stretching out. Again, if there's numbness, tingling, and burning, that's too intense, please give yourself a break, pause the video, then turn back to it. You want to try to limit the amount of numbness, tingling, and burning that you're feeling here. You have to be patient with yourself, and you don't want to make it worse. If your nerves are irritated here, you have to be very cautious and very, very patient with yourself. So I'm just showing you a different angle here. That's why I switched. It's just to show you the positioning of my knee and my arm. I'm making sure to really breathe through this. And stretching my arm, kind of moving it up and down, but I'm moving it down here and holding that, continuing to breathe. And then moving the arm up and holding that and continuing to breathe. So we're holding each of these stretches about 15 seconds. Again, if this is too much for you, I'm going to keep saying it. Pause the video and take a break if you need to. Do not push through this. So now, just to shorten the muscle, to help increase the blood flow to the pectoralis minor muscle and to alleviate some tension on this brachial plexus, we're going to cross our arm right over and tuck it up in behind. So again, I'm just going to remind you, whatever side you are suffering on, that is a side you are going to be crossing over. So you don't have to exactly mirror me. I'm doing my left side, but your issue could be on the right side. So this is one of the longer ones we're holding. So really get comfortable with this. So there's many studies that suggest shortening a muscle like we're doing now dramatically increases the blood flow and therefore helps to release the muscle. So this is why we're holding this position even more so than the stretches, because when we hold a stretch, sometimes that can be too intense, especially if we have neural and arterial involvement. So this is a very good way to keep everything nice and relaxed by also being very, very effective with attracting blood flow and therefore bringing health and oxygen and an optimal healing environment. And when everything's comfortable there, the muscle can then relax. So with every exhale, imagine that pectoralis minor muscle releasing. Imagine with every exhale, the nerves are getting less irritated. And you will notice that I shifted my head and side bent it towards the side that I'm crossing my arm over. So I side bent over to the left. And I'm holding this position even more because that will also help to shorten the scalenes and now help to attract blood flow there. That will also bring the brachial plexus, so that nerve plexus, into an even shorter position. So keep breathing and exhaling at a very slow and controlled pace. We're going to slowly release, so straighten out the head and slowly, slowly let the arm go out. So now we're going to do what's called reflex inhibition. So we're going to try to rotate out and press our fists into the floor and relax. So rotating these arms outward will help because the pectoralis minor and the pec muscle are internal rotators. Okay, they help to cross your arm in front of your body. So we're going to try to do the opposite of those movements to send a signal called reflex inhibition to relax them. And really try to squeeze shoulder blades together and push everything out. Really try to push your fists and rotate your fists back into the floor. And press, 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 press. And relax. Good. So now we're going to stretch the brachial plexus. So again, with this, you don't want any numbness, tingling, or burning. You just want a nice stretch. So your wrist is going to be right aligned with your elbow, and you're going to walk away from that. So about here, when the arm is right out to the side, you may start to feel quite an intense stretch. So if that's too much, go a little bit more back towards the wall. So don't forget to breathe here. And please don't mind me creepishly staring into the camera. I guess I was just making sure the angle was right. Now, if you can, you're going to rotate your chest even more so away. But again, there should be no numbness, tingling, or burning. We're going to gently start to introduce nerve flossing. So you're going to rotate now towards and then rotate away. So when you're rotating towards, we're shortening the nerves. And then when we're rotating away, we're tightening them. So essentially, we're almost gliding them back and forth in the neural tube that the nerves are in. And we're primarily working at the shoulder joint. So when we're completely rotating in, you should have no tension felt at all. And when you rotate out, you should feel just enough tension that it's comfortable for you, but not to the point where it's causing numbness, tingling, or burning. Now we're going to rotate away as much as we can comfortably and bend at the elbow and straighten. Remember, fingers down towards the floor, bend at the elbow, and straighten. That's all we're going to be doing here at this last little portion, bending and straightening the elbow. Again, no numbness, tingling, or burning. We're just trying to alleviate a little bit of the tension that has developed in the nerve. Good, so if this is too much for you in terms of this angle, you rotate a little bit more towards the wall. That's how you decrease the intensity of this stretch. Now when you recover from this, I want you to slowly rotate back, slowly take your arm off the wall. Once again, my name is Nichelle Thomson. I'm a manual osteopath, and I want to thank you for taking time to watching this video. If you know anyone who would benefit from this, please let them know, share this video with them, and also subscribe to my channel if you want to be one of the first to be notified with any new videos that I release in the future. Thanks for all your support.